Facet joint dysfunction is also sometimes referred to as facet syndrome, which simply means that there's an inflammation, and we often will see this with spondylitis. Normally, the lumbar facet joints give the spine rigidity and protect the intervertebral discs against rotational injury. The pathology of the facet joints can account for as much as 40% of all chronic low back pain. A dislocated or subluxated facet joint tends to lock the individual spinal segment, which causes the vertebral column to become hypermobile. The patient may describe a decrease in symptoms with an increase in activity. The onset of facet joint dysfunction is insidious, and the patient will say they are not sure when it began. They will complain of localized pain over the involved facets as well as the surrounding musculature. If we are looking at a mechanism, it will be something such as extension, rotation, or lateral bending of the vertebrae, but again, it can be attributed to spondylitis. Predisposing conditions are those individuals who have repeated motions of spinal extension, rotation, or lateral bending in their jobs or in their daily activities. There also may be muscle imbalances that are found, and you can find this in patients who have scoliosis. When inspecting the area, the patient may assume a posture that lessens the pressure on the affected facets. You may be able to palpate local muscle spasm in those paravertebral muscles in the area. Functional test-wise, simply having them move through motions of extension, rotation, and lateral bending to the involved side will produce pain. As a practitioner, you do want to assess the trunk and pelvis musculature for tightness and weakness. Spring tests may cause pain or reveal decreased motion in the area of the facet joint locking. Neurologically, you want to see if there is any type of lower extremity screening that would demonstrate that there has been a continued degeneration of the facet joint, because in this case it may reduce the size of the intervertebral foramen and result in compression of the spinal nerve root. Special test-wise, the quadrant test may be positive.